Bag valve mask ventilation of an apneic adult patient. This skill is designed to evaluate your ability to provide immediate and aggressive ventilatory assistance to an apneic adult patient who has no other associated injuries. This is a non-trauma situation and the cervical procedures are not necessary. You are required to demonstrate sequentially all procedures you would perform, from simple maneuvers, suctioning adjuncts, and ventilation with a BVM. You must actually ventilate the mannequin for at least 1 minute with each adjunct and procedure utilized. I will serve as your trained assistant and will be interacting with you throughout the skill. I will correctly carry out your orders upon your direction. Do you have any questions?
No, ma'am.
At this time, please take 2 minutes to check your equipment and prepare whatever you feel is necessary.
I am totally prepared.
Upon your arrival to the scene, you find a patient lying motionless on the floor. Bystanders tell you that the patient suddenly became unresponsive. The scene is safe and no hemorrhage or other immediate problem is found. You have 5 minutes to complete the skill.
BSI, scene safety. Sir, are you okay? I'm gonna check breathing for 5 to 10 seconds. Rise and fall of chest.
The patient is unresponsive and apneic.
I'm gonna call for ALS. I'm gonna check his carotid pulse for 5 to 10 seconds.
You palpate a weak carotid pulse at a rate of 60.
I'm gonna do head tilt chin lift.
The mouth is full of secretions and vomitus.
I'm gonna use a rigid suction catheter. Check it against my glove. And I want to insert and suction as I circular motions and removing for no more than 15 seconds.
The mouth and the oropharynx are clear.
I'm going to measure the oropharyngeal airway adjunct, and I'm going to measure it from the tip of his mouth to the tip of his earlobe, and it's right size. I'm going to push it flush against his lips.
No gag reflex is present and the patient accepts the airway adjunct.
I'm going to turn my supplemental oxygen to 15 liters per minute. I'm going to do the C and E grip. I'm going to do 2 seconds in, 4 seconds out. 1, 2, 1, 2, 3, 4, 1, 2, 1, 2, 3, 4, 1, 2, 2, 3,
Ventilation is being properly performed without difficulty.
I'm going to check his carotid pulse.
How would you know that you are delivering appropriate volumes with each ventilation?
The rise and fall of his chest.
And that concludes BVM ventilation of an apneic adult patient.